number these paragraphs. This is paragraph 1, paragraph 2, paragraph 3, paragraph 4, paragraph 5. Then first number the paragraph, then read the question. Hello guys, assalamu alaikum. It's Dr. Faraz Ahmad, and today I am here with a new video on OET reading. So in this video I am going to teach you, I am going to tell you everything about reading subtest of OET. So let's move to the topic without wasting any time. So guys, keep in mind that for OET reading test, which is basically consist of 3 parts. So guys, keep in mind OET reading test consists of 3 parts, and you have 1 hour for these 3 parts, and from these 3 parts you have 42 questions in combined. So please keep in mind you have to score just 30 marks out of 42 marks to pass or to get the B grade in your reading sub test. So this should be always keep in mind that you should have to score 30 marks out of 42. There are 3 different parts of the reading test that are described below. So let's discuss briefly. In part A of the reading test, you have 4 texts on the same topic. Keep in mind in part A you have same topic and you have 4 texts. For part A you have just 15 minutes. In 15 minutes you have to solve 20 questions. So keep in mind part A, 4 texts, 15 minutes and 20 questions. This is all about part A. So for part B and part C you have in combined 45 minutes for B and part C. Part B you have 6 small texts from workplace communication in healthcare setting. So from these 6 texts, from these 6 extracts, you have 6 questions, that is 1 question from each text. So you have to keep in mind what? 1 question from each text. So questions in part B and C both are multiple choice question, but keep in mind in part B you have just 3 options and in part C you have 4 options. And you have to spend roughly 10 to 12 minutes in part B, which is 2 minutes per question in part B. So let me tell you briefly about the part C. In part C, 2 long passages providing the information on different healthcare topics. You have to read 2 long passages in part C, 8 questions from the each passage, and you have to answer 8 questions from each passage. In combined you have to answer 16 questions. Okay, as I have already told you that these are multiple choice questions and 4 options in part C, and you have 30 or 35 minutes for part C exam. 2 passages in 30 minutes. This means 15 minutes for each passage. This is a really easy task, don't worry at all. So let me tell you now a brief detail about part A, part B and part C. Let's start with part A. As I have already told you that there are 4 texts on the same topic, and these texts may include the simple text, may include flowcharts, diagrams or tables. Okay, I have already told you have 15 minutes and 20 questions. For part A, keep in mind 4 texts, 15 minutes and 20 questions. But there is one good thing, that this is the most easiest part of the reading exam. Part A is the most easiest part. So most of the time your reading result depends on part A. Part A have a large number of your result marks, that is you have 20 marks from part A of your reading test. So most of the time if you are very good, you're scoring good in part A, like you are scoring 18 or 19, 20 in part A, so don't worry at all, you can easily pass your exam. So if you don't score good in part A, don't worry, there are other parts, part B and part C. You can also score good and you can clear your exam as well. But most of the time your results depend upon the result of the part A. And there is one important thing which most of the students don't know, that this paper will be collected back after first 15 minutes. After 15 minutes your part A paper will be collected back. Okay, so there are 20 questions in part A, and there are 3 types of questions. First 7 questions are matching questions. The next questions I will tell you shortly. So first 7 questions, question 1 to question number 7, they are very simple matching type of the questions. Like they will ask symptoms of the disease were given, were explained in which text. You have to just write A, B or C in your answer. This is very simple. First 7 questions, so it's better to answer these questions at the end of part A. First answer question 6 to 14, then answer 15 to 20. At the end I will suggest here that you should answer first 7 questions. Okay, so the other questions, question number 8 to 14, they are short answers question. These are short answer questions. Answer may include a word, number or both from the 4 texts. So let me give an example. What is the most likely cause of iron deficiency in children? This is excessive cow milk. This answer will be given in your 4 texts. So be brief, be very vigilant when you are reading these 4 texts, so you can answer the questions very briefly and in a correct way. And last 5 to 6 questions of the part A are fill in the blanks type of questions. Fill in the blanks type of questions, and you have to fill in the blank which you read from the text. Okay, let me give you an example here. In comparison to the breast milk and the infant formula milk, cow milk is dash. You have to read the text very carefully, very vigilantly, and then you have to put the word from the text exactly the same in this blank space, that is low in iron. Okay, so let's discuss some strategies how to attempt part A. So when you are going to attempt part A, keep in mind 4 text 15 minutes 20 questions. 4 text 15 minutes 20 questions. Always keep in mind these 3 things. So let's discuss the strategies. The most important strategy for part A is skim and scan. Skim and scan. As you know, there are only 15 minutes and there are 4 texts. So you can't read whole text in detail in these 15 minutes. So just skim and scan. That is very good strategy for part A. So skim and scan all the 4 texts just in 3 to 4 minutes. You have to spend just 3 to 4 minutes in 4 text. Read and underline the headings, subheadings, any values, any numbers, any points, any highlighted things in these texts. You should underline and read them carefully. So when you are going to solve the paper, leave the first questions, as I already told you. Start from the question number 8. Answer should be exactly the same as in the text. You should have to put exactly the same words or values as given in the text in your answer. Okay, answer the question 7 to 14 in 3 to 4 minutes. As you have read the text in 4 minutes, so answer the question 7 to 14 in 4 minutes. It is 8 minutes. Okay, when you are not getting any question, when you are not following, you are not getting answer of any question, leave it and move forward. Don't waste time on these questions. You will surely find the answer of that question while you are attempting the other questions. So answer the question 15 to 20 in next 3 to 4 minutes. So first 4 minutes, the next 4 minutes, and now 4. These are overall 12 minutes. At the end, you can answer first 7 questions just in a minute. In first 7 questions, you have to just mention the text number, text A, text B, text C, or text D. So you can attempt all these 7 questions just in a minute. So don't worry at all for these first 7 questions. While practicing for your OET reading test, try to complete the part A of the test in just 12 to 13 minutes. So when you have a very good practice of completing part A in just 12 to 13 minutes, then you will definitely complete the part A in your OET exam in 12 to 13 minutes as well. So at least score 16 in this part to take yourself at a safer side. Minimum score in part A should be 16. keep in mind this score. So your score should be 16. So let's move forward. So here I have given the pictures. I show you about the different texts, as I have already told you in part A. So this is part text A. There will be a brief description about the topic you are going to discuss in these 4 topics. Like this is the deep vein thrombosis, and there is a brief description. Okay, this is part B, causes of the deep vein thrombosis. They can ask you in which paragraph read about the causes of deep vein thrombosis, then you will definitely write about the text B. So this is the part C. They can ask about nursing care, in which paragraph you can write text C. And this is a pharmacological therapy. They can give any drug name and can ask from which paragraph this information is given. So this is given from text D. So in this way, these 4 texts, text A, text B, text C, and text D will be given, and you should have to just skim and scan these 4 texts in just 3 to 4 minutes. Okay, so let me show you the questions types in part A. As I have already told you that first 7 questions will be matching type of questions. Look, warning signs of the deep vein thrombosis. In which text you will simply write here text A, B, C, or D. Okay, common drugs regimes are given in which text, so you will simply write A, B, C, or D. The other 8 to 14 questions, as I have already told you, will be a simple answer question. You will have to put just a word or a phrase here. What is the drug used for the pain management? You have just write the drug name. It may be morphine, Panadol, anything from the paragraph. So this is just very simple. The last the last 5 questions from question 15 to 20, as I have told you that they will be a fill in the blanks type of the questions. So you will just put a word here. Improving the flow of blood and decreasing the swelling and pain is advantage of what? So you have to put the answer here from your text. Okay, so this is all about part A. Let's move to the part B. I will tell you about part B in brief details. As I have already told you about part B, that there are 6 different extracts, 6 text, small texts, 150 to 200 words. In each text you will have 150 to 200 words, and you have 6 questions, which mean 1 question from each text or each extract. As I have already told you that there will be a multiple choice questions with 3 options in part B. Spend roughly 10 to 12 minutes on these 6 questions. So you have to spend 2 minutes maximum on a question in part B. So let me tell you some strategies about part B in this slide. So most of the students, as I have already told you, that lose marks in part B and part C. So let me discuss some strategies about part B, so you can really improve your score in part B. First of all, keep in mind, don't read the passage, don't read the text given, just read the question. Read the question in 4, 5, 6 seconds, then read the extract. After question, don't read the options. After reading question, you should have to read extract carefully. First read the question, then read extract, then read options. On third, you have to read the options and then answer carefully. Let's take an example that you read the question in 10 seconds, then you have 1 minute and 15 seconds to read your extract and options. So read your extracts in 1 minute and 20 seconds with full care. Then read your options in 20 seconds. So you have consumes your 1 minute and 30 seconds here. Now you have 30 seconds to answer. So in this way you can use your 2 minutes on reading part B to answer each question. And one thing important, keep in mind that minimum you have to score 4 out of these 6 questions. As in part A you have to score minimum 16, and in part B score minimum 4 score. In this way you will getting 20 score out of 30 in part A and part B. sorry, 20 out of 26 in part A and part B. This type of the text or the extracts are given in exam for your part B, and as I have already told you that there are 6 extracts and you have one question from each extract. So this is extracts of 150 to 200 words. Read the question carefully, then read the extract, then read the options and answer the option. You have to fill this circle very carefully. Don't go out of this line. Okay, so this is all about the part B. This is part C. This is the most difficult and lengthy part of the reading exam. Most of the people don't practice well for part C, and they lose their marks in this part of the test. So don't lose hope. Try to improve your reading and you will get very good marks in part C, as this is not very much difficult as most of the people think. Okay, although this is most difficult from of the parts of exam, that is part A, part B. So in this test you have 2 long passages and you have to attempt 8 questions from each passage. In combine you have to attempt 16 questions from both paragraphs, both passages in combine. And as I have already told you that these are multiple choice questions and there will be 4 options of each question, and you have 30 to 15 minutes for part C. In you can say like that you have 15 minutes, 15 to 17 minutes for each passage. So this is much time for these passages. Okay, let's discuss about the strategies how to attempt part C, which is most difficult and most lengthy part of the reading exam. So first of all, keep in mind, don't read the whole passage, as most of the students do. What they do, they read the whole passage in one go and then they start attempting the question, and in this way they can easily forget what they have read from the passage. Don't read the whole passage. First of all, what you have to do is number the paragraphs, like paragraph 1, paragraph 2, paragraph 3. A whole passage is given in different paragraphs. There may be 6, 7 or 8 paragraphs in each passage. So first thing what you have to do is number the paragraphs like 1, 2 and 3. Then read the question number 1 and then read the paragraph with full concentration. Keep in mind that question would be in proper order according to the text. That means that question number 1 will be according to paragraph 1, question number 2 will be according to paragraph 2. Keep in mind, first of all, number the paragraph, then read the question, then read the paragraph 1, 2 or 3 and then answer the question. Then read the MCQs option and then answer. So this is very basic and very important strategy for part C. What is the strategy? Number the paragraph, then read the question number 1, then read the paragraph number 1, then read the MCQs option and then answer. So in this way you can score well in reading part C. So you should have to score at least 5 out of 8 or 10 out of 16 in part C. Okay, you can easily understand that what I was saying to you. This is a paragraph, a passage from part C exam. This is text 2. Carrying means curing. So these are the different paragraphs in whole passage. You have to number these paragraphs. This is paragraph 1, paragraph 2, paragraph 3, paragraph 4, paragraph 5, then paragraph 6. Okay, first number the paragraph, then read the question. In paragraph 1, what is meant by the word clustered? So guys, just read the questions, don't read the option, then go back and read the passage carefully. What is meant by clustered? So here is clustered. Then you will read this carefully and you will get your answer. Then go again, read the options and tick the answer here. In this way you will go forward. The use of the sedatives as mentioned in paragraph 1. So this question 2 is also from paragraph number 1. So read the complete passage then answer. In this way you can score well in part C. In what was the strategy? First of all, number the paragraph, read the question, read the passage, then answer. So in this way you can easily score well in part C, which is most important and most lengthy and difficult part of the reading exam. So guys, this is all about the reading part of OET exam. So improve your reading, read the newspaper, read any books, read some your medical books, improve your reading. Don't worry at all, your passages, your paragraphs will be from medical knowledge, so you can easily score well in reading part of the exam. This is very easy exam. Don't worry about reading and listening, you will definitely pass these exams. So best of luck for your exam. Remember me in your prayers. Thank you very much. Bye bye. Allah Hafiz.